Welcome to our presentation, Telehealth Attitudes and Experiences of Reproductive Age, Older Ethnic Minority Women with HIV in Southern Florida. I'm Lunthita Dulethy with the University of Miami School of Medicine. These are my contributors. I have nothing to disclose, and my acknowledgments. The literature supports technology to improve health outcomes and reduce comorbidities amongst people with HIV. However, the digital divide may exacerbate health disparities. We sought, therefore, to measure participants' attitudes and experiences using telehealth services at the start of the SARS-CoV-2 pandemic. This was a convenient sample of 77 women, and we administered a telehealth questionnaire examining their willingness, experience, concern, and perceived benefits of telehealth. There were descriptive statistics using the chi-square and the Fisher's exact. The majority of the participants were African American, Caribbean American, and Hispanic, not employed full-time, and living with HIV for more than 10 years. The majority were virologically suppressed. Older women were more willing to use video, however, a smaller proportion had actually had experience. Older women were concerned about being seen in the clinic, concerned about being able to express themselves with their physician, and also concerned about not being able to be examined by the physician. Also, older women had more concerns about data security and safety and data excessive use on their devices. In general, differences were found regarding attitudes and experiences and concerns with telehealth when we compared older women to younger women. Larger studies are needed to further test these relationships. Clinics should consider the needs of women along the life course, older women to older women, when using mHealth and eHealth for clinical services and when designing technology-based interventions to improve adherence to care. Thank you.